Hello, I'm Lisa, a pediatric physiotherapist for babies and toddlers. I've seen firsthand how small, everyday habits in modern parenting can lead to big issues for our babies. In this podcast, I'm going to show you how to prevent those issues, treat them if necessary, and restore the joy to parenting. Hello and welcome back to the Best for Baby podcast. I'm your host, Lisa Rogers-Sargent, and today's topic is not strictly baby related. I would like to tell you what's been going on with me, but I find it incredibly relevant and helpful for this podcast because, in fact, this podcast should probably be called Best for Baby and Best for Mum. And today's topic is something that is really best for mum. It's about the mother's health. And it's particularly relevant because it's something that's now happened to me, and I understand it's quite common in women, and particularly it's quite common in the first year after having a baby. And so I feel it's really relevant to talk about, and if I can help just one mum know a little bit more about it, if it happens to her, be a little bit reassured and therefore not have such a terrifying journey as I have had, then it will be totally worth it. So to start off, it's also a way of apologizing. As I said last week, I've had a really long time off, and that's because I have been so unwell. So this is also my explanation of that. And what it is that I have now been diagnosed with something called Graves' disease. And that is basically just an autoimmune condition whereby your body starts to attack your thyroid. And so suddenly your thyroid starts overproducing some of the hormones that it usually produces, and as a result your body is suddenly flooded with all of these thyroid hormones and you go into overdrive. It's like your motor in your body just goes onto overdrive, and it goes fast and it churns and everything is affected because the thyroid controls so many parts of our bodies. So today I'd like to tell you a little bit about it. I'll tell you a bit about my journey, and also just to give you some understanding of why it's important to know about as a new mum, because as I said, it does happen regularly. There is a condition called postpartum thyroiditis. So just having a baby can, with your change in hormones of having a baby, can lead to this condition that is very similar to Graves' disease, and a lot of the symptoms may be dismissed as typical mum stage after having a new baby. You're exhausted, you're anxious, you're jittery, you're a bit wired sometimes, you're sleep deprived, and so the symptoms look quite similar. And each person who has a thyroid condition, so I'll tell you about my journey with Graves, but in fact thyroid conditions, not just Graves' disease, are quite common after having a baby in that first year. And so every person with a thyroid condition, and certainly each person with Graves, will present slightly differently or in different degrees, but a lot of the symptoms will end up being dismissed as just to be expected in that early phase of having a baby. So I would really like to talk you through that and make sure that you don't get dismissed. And even if you don't, I had quite a tricky journey, and I was really, really lucky because I was able to access professionals repeatedly, whereas I think a lot of people wouldn't have that luxury, and you need to really be in control of getting to the answers and being supported through the journey so you can feel a lot better. So what is Graves' disease? As I said, it's an autoimmune condition where your body starts to attack your thyroid. Now with me, it seems to have followed being really ill. So in December, I had quite a severe flu with a really bad headache. At the time, I said to my husband, I think I've got COVID, because I've had it twice before and it just feels different to how other flus and colds have felt in the past. And so my understanding, what I've since heard, because I've now spoken to quite a few women who have Graves' disease, and they have been told, or their pattern has followed, being really severely ill or having COVID. And I guess it makes sense. A lot of autoimmune diseases do start this way, where your body has been fighting against a virus and it just doesn't know how to turn itself off once you have become well from your infection. And so your body starts to attack itself. So I guess that does make a bit of sense. And what it causes is this overactive thyroid. Now, as I've said, the thyroid controls just about everything in your body. It is like the computer behind the motor, telling the motor what to do. And suddenly the computer's been told to go super, super fast. And so everything kind of speeds up. And that's the overactive thyroid. Now, what often happens is following an illness or following giving birth, and in the first year of life, your thyroid is more susceptible to being affected and to something we call thyroiditis. Now, that was in the beginning, the doctors were querying, perhaps I had thyroiditis, which is just an inflammation of the thyroid following an illness. And that's quite common in that first year after having a baby. And so both of them present as this sudden, super overactive thyroid. However, if you have Graves' disease, the autoimmune condition, there is a medication you can take. And unfortunately, it's quite a long-term medication that you take. And it's slowly, your body comes back under control. Your body stops attacking your thyroid. However, if your thyroid is just inflamed, the thyroid itself isn't overproducing thyroid hormone. It's simply leaking thyroid hormone into the body because it is inflamed. And after a while, you run out of thyroid hormone, and so it stops naturally. It sorts itself out. However, then a lot of people will follow with an underactive thyroid. So those are quite different symptoms. So if we think of the overactive thyroid, we have the racing heart, the palpitations, the shortness of breath, weakness, tremor. You feel anxious, you feel wired, you're twitchy and jittery, losing weight. Whereas the underactive thyroid, you're far more sluggish, you're very tired, and we find there's a gain in weight. So if you've got an inflammation of the thyroid following illness, you tend to go through the overactive followed by the underactive. And as I said, both of these are common in the first year after having a baby. And you can imagine all of those symptoms can be put down to recently having a baby and having very little sleep and being very anxious. Lots of mothers are very anxious in that first year of life of their babies, me included. And so for me, the difference was that my heart was out of control. And so I went to A&E, and I'll tell you about that in a moment, because it was so scary. But a lot of people won't be that severe. And since I've had my diagnosis, as I said, I've spoken to women who also have it. And one woman told me that she had waited for 2 years before seeking help, because although her heart rate was elevated, it wasn't as crazy high as mine, and she would have palpitations, but they weren't so severe as mine. And so she wasn't quite as worried. So it took her 2 years, and she lost, she said, something like 30 kilograms in 2 years. She's now on the same treatment I'm on, and her whole life has changed. She feels completely different. It also, I didn't say before, it really affects your moods. And so you can be really low, you can be really snappy, you can, it's all those symptoms, again, that you can be when you're overtired or you have a new baby. So really, what I wanted to tell you is my journey, because I think I discovered along the way what needs to be done. And it's a very tricky disease to diagnose, to get under control, and to feel better again. But you can feel better again. It's amazing the difference. So I would hate for anyone not to move through the pathway quickly like I did. But the only reason I moved through the pathway so quickly is because I had additional help. Whereas I think if I hadn't have had that additional help and I didn't have the information I now have, I might have been a little bit stuck and terrified along the way. So as I say, I was really ill. I then recovered from that illness, and I started to feel that I was having this racing heart all the time, but I didn't stop and measure my heart at any stage. I don't wear a smartwatch. So when I did finally measure my pulse, it had to be done manually. So I didn't think to do that at any stage, but I could feel it. And I started getting more and more palpitations. And the whole time in my mind, I thought, I'm probably not recovered from being ill. We've been away, we've been on holiday, and therefore I've just been relaxing. Now I'm back into life, and maybe I can feel the effects of the illness, and I've just got to give my body time. However, I then did try to go to the gym on one occasion, and I tried to run, and it was impossible. I could feel my heart. It felt like it was going to explode. My whole chest. It wasn't like a chest pain that a heart attack pain probably feels like, where they talk about a tight belt around the chest and that feeling of impending doom. It was never that. It was just my entire chest, like a big block, was painful. I felt like my heart couldn't go any faster. It felt dangerous. It felt terrifying. And so I realized I couldn't run. I stopped and gave myself more time. And until I realized, I walked to the station, and it's a slow, gentle stroll of 5 minutes, and I got there. and my heart was racing, and I took my pulse and it was about 145. Now for me, a normal resting pulse is in the 60s, and probably after a slow walk to the station wouldn't be much over 80, 85. So this pulse was quite scary. I took myself to the pharmacy. There we measured my blood pressure, which was slightly elevated, but it wasn't so high that I panicked immediately, because if your blood pressure is high, then you are at more risk and you would be more concerned about other things happening. But it was just my pulse, and I realized my resting pulse was around 100, and I couldn't understand why that could be. I also felt, and I'd noticed since I'd been on holiday, that my calf muscles were stiff. And I didn't think, now I'm a physiotherapist, these are things I know about DVT. And at the time I was thinking, surely it's not a DVT. It's weird though, because it's both calves, but they're stiff. And I didn't look to check if they were swollen. I didn't think so much, but I had it in my head. And because we had been on an aeroplane, I thought, I wonder if this is a DVT. What's going on? And I sort of worried. Anyway, that night I tried to go to sleep, and my heart was racing. My palpitations were painful. I could hear every beat of my heart. My eyes, every time my heart beat, my vision would go, but it was fast, like this with my heart. And so it was really, really scary. And finally, I said to my husband, I'm going to A&E. And off I went, and I left him here at home with my daughter. And in A&E, they run all the tests. So they can do a blood test that will exclude DVT or embolism. So they check that that's not the case, because I said my calves are stiff. However, they are so busy in A&E, and they're just kind of checking for the life-threatening things. And so nobody really assessed my legs or looked at them. And they ran tests, they did an ECG, and they said, look, your heart is fine. We don't know why it's racing. It is flying along. We don't know why, but we're not afraid to discharge you. You can go home. After 15 hours, I had been there through the night and half of the next day. And they gave me a magnesium drip, and they gave me fluids. And they referred me back to my GP, but they had also taken other tests, which included your thyroid function, which at that stage I thought, I wonder, it could be my thyroid, but that's unlikely because I have no family history of thyroid issues. And so I just didn't think it could be that. Little did I know. And at that stage, I was a bit concerned. Now, I'm 47 years old, and I didn't think it's possible that I could be pregnant. However, I was in that 2-week window. Now, if you have a little baby, perhaps you are in the stage of your life where you are hoping to have another baby. And here I was in A&E, and I suddenly said to them, before they gave me the magnesium drip, I said, what if I'm pregnant? Can I have the magnesium drip? And they said, well, you need to know. We can't give it to you if you're pregnant, but we're worried about your heart. So that was quite a difficult thing. Anyway, then the consultant came along and said, just give it to her. If there's a problem with her heart, that kind of trumps the baby's health, which I guess that's A&E mindset. However, so I had this drip. I went home. I just thought to myself, I'm pretty sure I'm not going to be pregnant. However, in that 2-week period, you can't test. And so it's quite a thing. I then did go to the GP, and my results showed my thyroid was completely what they called deranged. So thereafter, everyone told me my thyroid was deranged in all levels, which is a fun word to hear. But basically, it just meant that all my hormones corresponded with this very, very overactive thyroid. But it was to the extreme. Like, one of the measurements is something called TSH, thyroid stimulating hormone. And that was so low they couldn't measure it. So it was super, super low. Anyway, the GP then prescribed me beta blockers, and this is the course of treatment. If you have a thyroiditis, so at this stage we didn't know if my thyroid was inflamed or if it was Graves' disease, an autoimmune condition. And nobody could tell me definitively if having my heart racing around like this was doing it damage, but they all said to me, you need to be on beta blockers, which are cardioprotective, which means they're protecting your heart. So surely if I'm not on them, I've been doing damage to my heart. I didn't know. Nobody could tell me this. ChatGPT, however, said that it's unlikely for a short period. And then I have friends who are doctors, and they all said to me, normal heart rate can be between 60 and 100. So if it's over 110 at rest, then we're probably going to be a bit more worried about your heart health. I didn't know if I had been over 110. I knew I was sitting around the 100 mark for a long time. Anyway, so the beta blockers are prescribed. Now, there is one beta blocker that is known to be the best one that works quite well with the thyroid medication that they give you once they know if you have Graves' disease or not. And these two work together well. And I was prescribed something else, a different beta blocker. It's called cardio-specific. So it only helps your heart symptoms. It doesn't help anything else. By this stage, I was at my worst in my Graves' journey. And so I was weak. My calves were swollen and they were so stiff. It hurt to walk, but I was so twittery and jittery. If I held my hand out in front of me, my whole hand would shake. And I'd started to notice I couldn't walk down the stairs. When I tried to walk downstairs, I had to hold on to the railing. Otherwise, I just wasn't strong enough to lower my leg to the step below. And I was prescribed something that just slows down your heart. And I was prescribed a very low dose. And I was also told to take a pregnancy test, again, before I started any of these medications. And I said, well, I'm in the 2-week window. And she said, well, you can't take these medications if you're pregnant. And so by now, I was worrying about the state of my heart. I was wanting to take drugs to protect it. I was so uncomfortable. I was desperate for something to manage my symptoms. And I'm looking after a 5-year-old. At this stage, I'm back to work. I've been on Christmas holidays. And it was too much for me. Fortunately, however, then I realized I was a bit further along in the 2-week window and I was able to actually take successful pregnancy tests, which showed that I wasn't pregnant. And so I could start these drugs. Then you get stuck on a weekend with no one helping you and the drugs aren't working. And I went back to my GP and I had an amazing GP who actually looked at me and we found something called pitting edema, which is where if you push the swelling, it doesn't bounce back. You're left with like a little finger hole in your leg. And my legs had started to do that, which is not typically a symptom of Graves' disease. But I was worrying because it's a typical symptom of heart failure. So I was quite stressed. And anyway, the GP then sent me to something called E16, which is the same day emergency center, I think, at the hospital. And so I had to go back there the next day and sit waiting for a good 7 hours. And in this time, they just ran all the same blood tests. Now, I had given so much blood by this time. Everyone had taken blood from me, but we were still no closer to understanding if I had Graves' disease or if I just had this thyroiditis. And I still hadn't seen an endocrinologist. Nobody did something. They should do an ultrasound of your thyroid, and that's a bit more definitive. And my understanding is you should start on the drugs for your thyroid quite quickly, because they take a really long time to work. And only once they've been in your system and working for quite a long time can you start to wean off the beta blockers for your heart. And I love the NHS. I had my baby on the NHS and it was amazing. I've worked in the NHS. It's incredible. I think it is amazing. But at this stage, I was failed and it was the wrong medication, as I say. So my symptoms weren't being controlled. Nobody was speaking to me. Somebody promised me it looked like I had thyroiditis. I was just left hanging for a good 2 weeks. And eventually, I just booked myself to see a private cardiologist who did a number of assessments of my heart, because he said, I can hear turbulence and you've got a heart murmur. And these things also can be triggered by the thyroid. So he just checked all of that out, which was amazing. And I don't think that would be a standard thing to do. But I think because I was left for quite some time and my symptoms were very, very strong, I was more concerned and I wanted to go and see a cardiologist as well. And in this time, I managed to get the private GPs to switch me over to the correct beta blocker, which then treated all my symptoms. And that was really tricky because some people take propranolol, the correct beta blocker, just to help with anxiety and palpitations when they're a bit nervous. And they might take 1 or 2 tablets a day. I was taking 10 tablets a day, but they started me on a dosage of 2 tablets a day. And I needed a GP to help me slowly build up from that tiny dose to a massive dose. And as I say, I was very, very lucky that I had access to regular GP remote consultations that were private, and they assisted me to get my dosage right up until it was controlling my symptoms completely. And then during this time, I also went back to the same day emergency center where I ended up seeing the NHS endocrinologist, who was amazing. He was really helpful, and he said to me, you definitely have Graves' disease, and prescribed the correct thyroid medication. He said to me, you should have been started on the thyroid medication right at the beginning of this journey, because then by now you'd be 2 weeks on it and it would be starting to help make you feel a bit better. So in all of that, I didn't know that I was ever going to see an endocrinologist at this place. So I had also booked in the private endocrinologist, who was amazing and told me he's also probably going to be seeing me in the NHS because he works there too. So they are amazing, amazing specialists. It's just your access to these people that's really tricky. And anyway, so what I'm saying to you is, as a new mum, you are very likely to feel some of the symptoms that I felt. You are also likely to feel symptoms of being a new mum that are the same as someone with an underactive thyroid, because these are common in that first year after having a baby. And what I want to say to everyone is, if you have my symptoms, your heart is racing, you are jittery, you are moody, you are anxious, more so than is explainable by your situation. And it's usually a sudden change. It's not the slow burner where these things get worse. It can be the sudden change. And that's when you do need to seek help. And I think if you ever have symptoms of a racing heart, anything like that, you've got to get yourself to A&E, even if you have to sit there for 15 hours like I did, because it's essential that they rule out anything like that. I'd also like to say that I had that whole awkward pregnancy test thing that I had to make sure I was not pregnant before I started any of these drugs. And that's quite a hard thing to take, knowing that even though I'm going to be weaned off the beta blockers quite soon, in the next month or two, I will be taking this other drug for a minimum. He first said 6 years, but I've seen him again since, and my bloods are now responding quite well to the medication. So it seems like it might be 3 or 4 years. I think if you are hoping to have more children, this is quite a big thing that you need to know about. And so I think the sooner you are treated, the sooner you are in the correct hands, the better for you, and the better you can make plans that are good for you. But also to understand that when you do end up in A&E or you are prescribed all these drugs, nobody ever said to me, could you be pregnant? Now, maybe I'm being a bit vain in that, saying, nobody asked me. And that's probably because of my age. But you might be a lot younger and you may not be asked that. And I think some of these drugs are really strong drugs, and you need to have that at the ready to say, look, I don't know if I'm pregnant. Can we wait for 2 weeks? And the answer is you can actually wait for 2 weeks, because 2 weeks is not a lot if your symptoms aren't so bad. And it really is about symptom control more than anything else. So you can wait your 2 weeks until you've had a negative pregnancy test and then carry on. But that's something I would want to say if you start a journey like that. The key here also is to insist on having blood tests that are conclusive to tell the difference between Graves' disease, the autoimmune condition, and just a thyroiditis. I had to ask and ask and ask for this test, and my NHS result never came back. So that's been 5 weeks since it was done. It never came back. I was told it can take 2 to 3 weeks. One of my NHS tests also came back for something called T3. It's another indicator of the thyroid function. And it's important to have these as a baseline, because as you go on your journey of having these drugs, they need to see that these levels are dropping, and therefore they can start weaning you down and reducing your medication. So you need to have your baseline when your bloods are done. My result came back that the machine wasn't working and the sample was too old to retest. So we never got that. So those were 2 crucial blood tests that never came back for me. However, because the wonderful GP that I saw in the NHS one night when I was really scared and swollen legs and felt like I hadn't been helped, who she then referred me onto the same day emergency centre, they took those bloods. So at least I had those as a baseline, which is really important. Also because those are the tests that finally they redid the antibodies, and thank goodness they did, because that was the result that finally came back that conclusively said that I have Graves' disease. The other thing is that the drug that you take if you're on Graves' disease can very rarely cause your white blood cells to drop. And so this has to be checked. In order to see what your baseline is, you need to have a full blood count ordered, and my GP never ordered it. So again, thank goodness I went to the same day emergency care centre, and they did the full blood count. And when I went back to see the NHS GP, he could access that, and he could see that my white blood cells before I started the drug were exceptionally low. And that's quite a worry, because a side effect could be that the drug drops your white blood cells, and that could be a problem. And so I was lucky to see that it was already low before I started, and only last night, actually, when I saw the private endocrinologist for my review, did he say to me, oh yes, that's the overactive thyroid. It can also do that because mine, as I say, was so extreme. It had significantly lowered my white blood cells. But my blood tests, since being on the correct medication now for quite some time, have shown my blood cells have come back up. So they're looking a lot better. Now, all of this has happened. I've had all this access to private care, and I don't like to go on about that because I always feel like the NHS has always been amazing. But I think if I had known what I knew then, I would have been able to say, I need these tests, I need this baseline, I need an appointment follow-up at this time so that we can check my bloods. I need to make sure I have prescriptions, because that's the other thing. I was running out of, when you're taking 10 tablets a day of beta blockers, that doesn't even last you 3 days. So I was running out of tablets. I was having to book with a private GP to get a prescription to get more. And these are dangerous drugs. You can't just stop taking. But nobody was making sure I had my prescriptions. So as I say, I recently went back to my NHS GP who's put me on repeat prescriptions, and they haven't even come through yet. So if I wasn't having private prescriptions being written, I would be really, really stuck, because this is a slow process and you need a lot of tablets during this time. So my advice is, particularly if you're a new mom, but if you're just anybody with these symptoms, if you just know it's not your normal, you're not just tired, you're not just anxious, you're not just frustrated, it's an overdrive feeling coupled with palpitations, racing heart. Oh, the other fun thing is that you are very sweaty. Your temperature regulation is very poor. So you're hot, you're sweaty, you're jittery, you're shaky, you're weak, your legs are swollen. And of course, coupled with very rapid weight loss. So I lost weight very quickly. In like a 3-week period, I could see a massive difference. And I've been assured that that will all come back. But so all of these symptoms, please go ask for thyroid function. First of all, heart symptoms, you get yourself to A&E. Secondly, ask someone to look at your calf muscles, because this could also be a DVT. So get someone to look there, because they didn't look there for me. Know that there are heavy drugs coming your way that could be a problem if you are pregnant, and ask for follow-up appointments. Ask for a big prescription so that you don't run out of tablets, and you need follow-up blood tests to check what is happening to your body as you are responding. And so to wrap it up, I would just like to make you aware of what to look out for and what to do. So if you have had a baby, if you have any of the following symptoms that come on suddenly, it's something to think about, that it might not just be associated with having your baby. Look out for any of the following symptoms. So it's the unexplained weight loss, the racing heartbeat, the very strong palpitations, rage, irritability that are beyond normal, that are beyond sort of premenstrual or sleep deprived, feeling hot all the time, excessive sweating, very jittery, very weak, difficulty sleeping. Even when your baby's asleep, you find you can't sleep, and changes in your menstrual cycle. And often the biggest key is you just don't feel yourself. You know you are not yourself. There's something not right. You might not be able to put your finger on it. And the problem, because it's such a vague symptom, it obviously gets dismissed a lot of the time. So it's up to us to really advocate for our own care and treatment and investigations to make sure. So what do you need to do about it? Well, if you have these racing heart symptoms, get yourself to A&E. If you don't have immediate terrifying symptoms, get yourself an appointment with the GP. The biggest thing is to ask for baseline tests, a baseline full blood count to see your white blood cells particularly. Secondly, your thyroid function as well as thyroid antibodies, because this will tell you the difference between Graves' disease and postpartum thyroiditis or any other inflammatory thyroiditis. And then you need to ask for a follow-up appointment sooner rather than later, because if you are being prescribed drugs, you're going to need to replenish those drugs. And you also need to have those ongoing blood tests to see that your thyroid function is improving and that your white blood cells aren't dropping. And you need to ask what to do if your medication isn't working or you're trying to increase your dosage of beta blockers to control your symptoms and you are on your own. You need a specific plan on how to go up. I'm now at the stage where I want to start coming down again, and it's only because I've recently had my follow-up with my private cardiologist and my private endocrinologist that I suddenly have been told you can't just reduce it based on how you feel. If you reduce your beta blockers, you have to be on the reduced dose for 1 to 2 weeks before you then reduce it further, then 1 to 2 weeks before you reduce it further, which I didn't know. And I had already started to reduce my own dosage. So it's really important that you have a really clear plan of how the drugs are going to go up, how they're going to come down, and how you're going to be in conversation with a medical professional to help you get it correctly done so that you are covered. And then once you're feeling better, you can safely come off those medications. The other really important thing to know is that these drugs are very strong and they can affect a baby if you are pregnant. So that needs to be at the forefront of discussing with your doctor so that they can guide you accordingly. I think the key takeaway here is to remember that this is very, very treatable. It has a very high success rate of not coming back if you take the medication for long enough. And if it's postpartum thyroiditis or any other kind of thyroiditis, it does go of its own accord, but you need support while you're getting there. And the important thing is to get that support and help, because we always prioritize our babies over our own needs. So I know I was really unwell, and at times I was on my own with my daughter, and that came first. I had to just manage and get going, and it came close to me not managing. So please get that support if you feel any of those symptoms. I hope that has been helpful. I really wanted to normalize something that I didn't know about, even being in the business slightly. I didn't know enough about it, and I certainly wasn't prepared for my journey. I wish someone could have told me all of this before I started. So with that, I hope this doesn't happen to you. But if you do feel these symptoms, have a low threshold to going and getting help and having them checked out. Because as much as I always wish the best for your baby, I wish the best for you too. Being a mum, I think we are a little community of warriors who have very similar experiences and not always the time to discuss them and share the help, our wisdoms and our insights. So that's a big part of this podcast, and I really hope it's been helpful. Saying that, this is half term. My daughter's downstairs watching telly while I record this because I didn't want to have another gap. So please, I would appreciate so much any reviews or ratings, anything, because it will really help me and the show. Next week, I have got a very exciting guest. She is a pediatrician with lots and lots of helpful advice for us. So please do tune in next week as well. And with that, I'd like to wish your baby all the very, very best. And of course, you, all the new mums and the mums who have been mums for a little while, all the very, very best too.